Hi, thanks for joining me. Today, we're going to talk about hereditary spherocytosis. So, subscribe and let's get started. Alright, so we're going to start this with some very useful properties of red blood cells. Red blood cells have an elegant shape, a biconcave discoid shape that resembles a donut except without the central hole. This biconcave shape maximizes their surface area. Let's compare two structures. So we have a biconcave shape right here, okay? And we will compare this with a sphere. So the volume of the biconcave shape can actually be equal to that of the sphere, but then the surface area of the biconcave shape will be higher than that of the sphere. So this is a very useful property for red blood cells for efficient gas exchange. Measuring approximately about 7 to 8 micrometer, red blood cells exhibit a remarkable deformability, which is essential for navigating through some of the body's narrowest confines, such as the capillaries, as well as the fenestrations in the red pulp of the spleen. In summary, red blood cells have a remarkable deformability to allow them to withstand the mechanical stresses encountered in the body during their lifespan. All right, so we're going to start this with an analogy. Much like the human skeleton is intricately linked to the outer skin through a network of various connective tissues, red blood cells also exhibit a similar relationship between their inner cytoskeleton and their outer lipid bilayer. Right? So there is some proteins that connects the cytoskeleton to the outer lipid bilayer. This connection relies on essential protein structures such as spectrin. So we have alpha spectrin and beta spectrin. Okay, and spectrin, as you can see, is important. It's connected to the cytoskeleton. We also see ankyrin right here, which is also a protein that actually anchors the spectrin to other integral membrane proteins like band 3 protein, and it is also connected to protein 4.2. On this side, we also see protein 4.1 connected to actin. So what is the purpose? Of course, these components ensure a robust and a stable linkage that fortifies the cellular membrane and maintains the cell's overall structural integrity. It's very important for the red blood cells to be able to maneuver and have that remarkable deformability. So now in hereditary spherocytosis, which is a genetic condition, majority of it is autosomal dominant. There can also be a recessive pattern. There is a deficiency in one or more of these critical proteins that we just mentioned, right? Spectrin perhaps being the most common, but also ankyrin, as you see right here, band 3 proteins, protein 4.2, as well as 4.1 may all be affected, leading to a faulty linkage between the cell's inner part, that is the cell's cytoskeleton, and its membrane. In other words, we are talking about the lipid bilayer. All right, so the impaired linkage we just described for hereditary spherocytosis results in a weakened cytoskeletal support and a progressive loss of the lipid bilayer membrane, as you can see right here. And this occurs as the affected red blood cells tries to navigate through the microvasculature. And this leads to the characteristic spherical shape. As you can see, spherocytes are formed, okay? And they do compromise their flexibility as well as stability of the red blood cells. Normal red blood cells have a remarkable deformability. And in this case, this sphere would not possess that sort of deformability. There's going to be a reduction in that. And this ultimately results in a chronic extravascular hemolysis in the spleen. All right. So yeah, the sphere looks like a basketball. And I also have to say that normally the biconcave shape has a higher surface area compared to that of a sphere. And so we're going to have a reduction, okay, in the cell surface area to the volume ratio. That's very important. This is going to be reduced. That is, the cell surface area to the volume ratio will be reduced. And also spherocytes are characterized by the lack of the central pallor we see in normal red blood cells. Alright, it's certainly clear that hereditary spherocytosis is also a red blood cell membranopathy. The defect also leads to an abnormal passive permeability, of the cell membrane, and particularly this concerns cations such as sodiums and potassiums. As a result, there is an increased influx of sodiums into the affected red blood cells and potassiums out. And this leads to an osmotic imbalance. That is, these cells would swell if you put them into a hypotonic solution, creating an osmotic fragility that leaves the cells vulnerable to lysis. It is based on this that we have the test osmotic fragility test. Okay, there is also another test known as EMA binding test, coming from eosine maleimide test. So this is just a flow cytometry analysis where red blood cells from individuals suspected of having hereditary spherocytosis are treated with EMA dye. So you put the dye into the affected red blood cell. And in cases where there is a deficiency or absence of the proteins that we talked about, for example, band 3 proteins, all right, this means that the binding of the dye together with these proteins will become disrupted, resulting in a significantly lower mean fluorescence intensity of the EMA stain. So EMA test is valuable and is often recommended. Osmotic fragility test is not recommended routinely due to its lack of specificity. Hereditary spherocytosis classically presents with a triad of clinical manifestations: hemolysis, anemia, and splenomegaly. In hemolysis, patients often experience symptoms such as jaundice, dark urine, fatigue, and irritability. Anemia can manifest with fatigue, pallor, shortness of breath, tachycardia, as well as palpitations. Splenomegaly may be evident upon physical examination, leading to abdominal discomfort. Complications of hereditary spherocytosis can further complicate the clinical picture, as patients may develop gallstones due to increased bilirubin turnover, cholecystitis, and an increased risk of infections, especially from encapsulated organisms. Additionally, they may also face hemolytic crisis triggered by illness or stress, aplastic crisis often related to infections by parvovirus B19, and in young children, failure to thrive may present as a prominent concern, emphasizing the need for careful monitoring and management. Diagnosis. So a clinician often observes key hematological signs indicative of hemolysis, such as an elevated levels of indirect bilirubin and reticulocyte count alongside a decreased haptoglobin levels. A complete blood count may reveal anemia. Particularly an important feature of the disorder is an elevated mean corpuscular hemoglobin concentration. Coombs test typically used to assess autoimmune hemolysis is negative in these cases. It's important to recall that in autoimmune hemolytic anemia, there may also be a spherocyte. So Coombs test is very important. A peripheral blood smear would reveal the characteristic spherocytes which appear devoid of central pallor, typical of normal red blood cells. And additionally, EMA binding test as well as osmotic fragility test may also be positive. The management of hereditary spherocytosis often involves a multifaceted approach for moderate to severe cases, where splenectomy may be recommended ideally after the age of 6. This surgical intervention helps reduce hemolysis but doesn't prevent the ongoing formation of spherocytes. In cases of severe jaundice, blood transfusions or exchange transfusions might be necessary to avert the risk of kernicterus in newborn or infants. Furthermore, folic acid supplementation is also crucial to support erythropoiesis, and emerging research suggests that erythropoietin can also help diminish transfusion requirements. Lastly, immunization, especially against encapsulated bacteria, is vital to mitigate the increased risk of infections following splenectomy. Cholecystectomy may also be done in symptomatic patients undergoing splenectomy. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.